So like I said, we're gonna share a bit of the data from year one, as well as provide some time for y'all to do some just peer-to-peer connections with some breakout groups. Do a brief break, and then talk a bit about ways that the state is hoping to look at collecting race and ethnicity data, and we just kind of want to share where we are with that and kind of hope to connect some of you all within that work, and then provide some overall updates and provide space for question and answer discussion, things like that. Next slide. Next slide. So we compiled all of the data from your monthly reporting, and we just wanted to share that with you all in a pretty brief and condensed way to show all of the hard work that you've done from year one. So these are just a few of the different highlights that you all have shared over the last 10 months. And we just wanted to kind of showcase all of that hard work. So many of you brought on new staff, such as coordinators, identifying new council members, new partnerships, so that you could better serve your community and make sure that the priorities were really tailored. Some of that meant capacity building to facilitate community listening sessions, provide other trainings that would help you all identify your priorities and do some strategic planning. Another aspect of that was a lot of the great community events that you all held over the last few months. So some of that looked like screenings, PPE distribution, overall outreach around COVID-19, information regarding vaccines, testing sites, etc. And as well, many grants that you all were able to distribute throughout the community. So I know many of you have heard much about the mini grants that you all distributed during this past few months, and that resulted in over 100 mini grant contracts that were established and put out into the community through community-based organizations. As well as some of the community health worker trainings that you all established. So, identifying organizations that would bring on community health workers, establishing that training, getting those folks identified, and even utilizing them for community surveying, connections, etc. Next slide. Many of you were able to connect folks with testing services and resources. Such as testing kits, testing sites, connecting with partners to hold community testing events. And so I just wanted to kind of showcase all of that you were able to report there. And many of you were able to provide that information down to the race level. And much of what the information we had was around Black, African American, non-Hispanic folks that made up almost 83% of the overall amount, with those that had identified kind of those multiple races. So they're white, Asian American, American Indian, and Middle Eastern, North African folks are kind of all within that multiple race category. Additionally, this grant did focus on rural areas, and so some of you were able to connect directly with individuals who were located in rural areas. Next slide. We're also connecting with vaccination resources and services. So over 5,000 people were served And that resulted in 94 different resources that you all provided over the last few months. So, looking back at that education and outreach that we talked about on a few prior slides, some of those partner events, as well as, at-home vaccination support that could, look like anything from ride sharing to just kind of some information pieces. So I think this is definitely a space where we had a lot of folks who we didn't know the race of. But again, primarily we're able to break those out into a few of the different racial groups, and we see a majority of them within Black Americans, African Americans, and just sharing that with you all. Next slide. One of our performance measures also looked at overall data quality improvements. So that is looking at how you all were able to collect data, the infrastructure in which you're able to access that information, and kind of use that to strategize, establish priorities, maybe even target what kinds of mini grants you all would do. So some of the highlights that you all were able to share was really looking at COVID cases by your zip code. So some folks utilize the data TA requests to get some of that information and have it by, zip code or racial groups if that was something of interest to them, and utilizing that information to mobilize their community health workers, as well as leveraging that as a tool to access community data direct from those individuals. So some surveying that they were able to do with tablets or kind of QR codes to connect to a brief, Qualtrics, or SurveyMonkey, as well as kind of the visioning and asset mapping that many of you did with your councils, to kind of identify what are the resources we have now, what is it that we still need to establish. And some of you have been doing listening sessions, community health assessments. And so again, thinking more strategically about how do we connect with folks who maybe English isn't their first language, or there's a language that they would prefer as their primary spoken, written language, and making sure that that is something that's being pulled to the forefront when it's coming to developing those protocols, distributing materials, and collecting the data. Additionally, not only did y'all focus on the data aspect, but looking at the overall infrastructure that you have. So I think the biggest piece that you all really touched on with this is establishing your councils. That's why we were all here, and that was our central focus. But in addition to that, part of establishing your group and bringing everyone together is that capacity building piece. So lots of trainings that you all connected with us around through either TA requests or, kind of capacity building workshops that you identified yourself that you were interested in, that included the health equity training, the implicit bias, some health literacy and vaccine hesitancy pieces, as well as grant writing workshops and some data courses to really build the capacity within your council members to have those tools to look at data, to understand health equity, and to tie all of the pieces that they see day to day in the community together, and come together to strategize and identify your priorities and really narrow in on what it is you would like to do. Again, one more piece that you all really focused on that I want to kind of uplift is the racial and ethnic language changes, as well as gender and sexual orientation. So some folks really focused on language pieces. So not only the translation of languages, like I've mentioned, but also the terms and identifiers that folks are using, so that what we distribute as a community is more inclusive and representative of those living among us. Next slide. So one of the other things that we always talk about is the partnerships. So you all reported partnerships both in REDCap as well as the eco-mapping activity that we'll get to shortly. Through the partnerships that you all reported in REDCap, you had a total of 378. And then just kind of broke them out by the different partnership sector that individual or organization belonged in. And I think it really shows how much you all were able to connect throughout your community, as well as really kind of prioritizing community grassroots organizations, as well as community members, those that have those lived experiences and deeper understanding of the why of what's happening in the community. How can we really bring folks together and kind of create that trust and rebuild those relationships? Next slide. Shaharu, did you want to do the eco-map? I'm gonna pass it over to Shaharu to talk a bit about the eco-map and the partnerships, how we measured all of that.
Thank you.
Mhm.
My audio is working, correct?
Yeah, I can hear you.
Okay. Okay. So if you remember, we have done this eco-mapping activity. Just to jot down your memories, the eco-mapping is one of the many ways to learn about the partnership. Simply listing out the partners you engaged in, and looking back at those providers, looking at those provides reflection points and opportunities to see changes over time. As of any data collection activities, eco-mapping relies on the self-reports. In the world of network analysis, relationship does not exist if it's not being written or documented. So keep in mind when you see it and feels like that's not exactly how it is, it's possibly because of the documentation. That being said, partnership is not just about the numbers, meaning the bigger is not always necessarily better. You can achieve your goal by creating a bigger and wider but shallow web of partnership, but you could also achieve your goals with a smaller but deeper and dense web of network. Qualitative data is as important as quantitative data when it comes to look at the partnership data. Next slide, please. So, as you see, there's a whole bunch of numbers at the right-hand side. You will see them in a minute. This is a picture made from the spreadsheet you all shared. There's a slightly different numbers that you're seeing at the top, 410, possibly because this eco-map includes MDHHS OEMHT. Each dot represents the partners you listed by the sector. My software assigned the color. So if the color is hideous, I'm sorry, I did not have any control over it. You can think of this graph as a concept of this regional equity councils. You are all connected via OEMH. The size in each bubbles or island or whatever you call it are very different from council to council. But overall, collectively, you have identified 410 partners, ranging from 9 to 61 partners, with an average of 34 partnerships. Of those 410 organizations, 3 organizations showed up in 1 or more regional councils. As you can see, those oranges between Ingham and Kent. No, not Ingham. Ottawa and Kent. Kent and Access Health also share 2 of those organizations. Arbor Circle, Coral Health, and YMCA, but showed up in multiple places. This could be another documentation issues, as YMCA has a regional or local offices. If those are not specified in the data set, the data considers YMCA as the same YMCA, therefore it connects between them. But it could also be because you're actually connecting the same organizations. Looking at the sectors represented in the whole network. So now we are looking at the color of the dots. Community-based and civic organization was the largest group represented. This is nearly 30% of the partners that are categorized. This is followed by the health-related organizations. That would be in your map, the darker blue or navy color. Only a few partnerships were reported in the category of tribes or tribal organizations, state health department, and mental or behavioral health. Notice that there's a tiny arrow going in and from each bubbles. This was created from the flow of the resources. In the social network analysis, each resource exchange is counted as a one relationship. So with what we have so far in your Excel sheet, this collective partnerships included 776 relationship or traffic of resource exchanges. Within the network, service and resource combined. So service exchange and resource exchange combined were nearly half of the resources being exchanged. About the 10% of a relationship were connected through a funding, so such as grant activities. We are missing about 44 relationships in the data set. None of the council listed MDHHS or EMH as a partner. So in order to create an overall map, I added the connection between each of you and an OEMH. Next slide, please. So this represents the same information of a multi-sector partnership for each region, but represented in the proportion of that representation. So the more color represented in the picture, or more color represented, the more varieties of sectors we are engaging. That's all I have.
Thanks, Shar. Can we just go back to the slide really quick? I just want to answer a couple of the comments in the chats. We will be sending out the slides after the meeting as always, but this was just a condensed way to provide a view of all of the partnerships that you all have established and reported within the Inkle map at that time point. So February of 2023. And by looking at this overall diagram, you can kind of see I know it's a little small, but the red is the community-based civic organizations, and then that purple is kind of community members, residents, those with lived experience. And if you look at many of these roles, you can kind of see that is quite a significant portion of many of the partnerships that you all listed. And so that's something that kind of aligns with what you're reporting in REDCap, but also really says a bit about how you all are establishing your partnerships and who you all are prioritizing connecting with. I know we often talked about how important it is to make sure that this is community driven, that this, elevates and emphasizes community-based partnerships. So it's wonderful to see that connection there. And then Janie, the software to kind of create these is the Node Excel, right? Yeah, okay. And so Node Excel is great for what this is, the network analysis. Since we just this was a big overview of all of the data that you all had reported to us. And we wanted to share that with you all since this is the last month of year one as we lead into year two. Take a minute to really reflect on all of that information that was shared and, share in the chat or, kind of go into your breakout groups thinking about what were the things that really stood out to you. So if there's something that really stood out to you in this data presentation, feel free to drop that in the chat. And that would be really beneficial. I'll read it, share it, moderate it. So while folks are writing, I'm gonna just go to the next slide. I also wanted to talk about the TA that we were able to support you all with throughout these last few months. So much of what we were able to share has been in the form of these guidance documents. So not only were we responding to those TA requests, but we were thinking about what are the challenges that you all would report in your monthly surveys, as well as sharing with us when we all checked in, and tried to make some guidance pieces or provide the resources to really connect you all with that. So some of those documents were around centering equity and collective impact, since collective impact is kind of the framework that we really utilize to establish this, as well as some guidance documents about inclusive communication and language practices, thinking about how we're making our meetings more accessible so that people feel welcome, they're able to come. Implicit bias guidance document, and then a community engagement guide. We also tried to think about how complex this reporting is. We have these wonderful performance measures that were passed from the CDC to us, and we shared the love and passed those performance measure requirements down. And so ways that we could try and make reporting easier for you all, make it easier for your grantees. So there's a reporting guide on Padlet as well. We're able to package and share the Health Equity 101 training, the power mapping tools, eco mapping, etc. And then do some data support for folks. So, responding to requests of councils need data to really look at what's happening at a community level, really use the numbers with their understanding of why to identify priorities that will create a meaningful impact. So collecting some of that local level data of social determinants, COVID cases, deaths, vaccination, and then, just any other types of TA. We were here to help. I always say that this is a space for sharing, venting, and creating. So reviewing documents, helping with the design of different surveys, mini grant RFP, applications, etc. And so all that to say, there are lots of really good things that are on our Padlet page. I am going to drop the link and password in for you all for that, and also read some of the great comments that folks have shared. So many people love the visual bars as a way to show the different partnerships with each of the community-based organizations. Really like to see that partnership piece. And great job, everyone, with being intentional to engage with a diverse set of partners. I was impressed with the breadth of connections that we've been able to make and the extensive number of organizations that have engaged in this important work. Yeah, I think that is something that we've really put a lot of emphasis on right now, is really those partnerships, how we're connecting, how we're creating, how we're coming together. So next slide. I'm also putting the Padlet in the chat. So in case you all haven't checked it out, please give it a peek. That's where we've been putting all of these TA resources that I just talked about. Oh, can you just do the previous slide? So we have our peer learning groups. And this is really, you all said, I like hearing what people are doing, but I never really get a chance to engage with them. So I am going to talk less and really create some space for you all to connect with one another. So we're going to go into some breakout rooms and go over the discussion questions that Reid will give us a sneak peek to on the next slide. So feel free to, if it brings you comfort, jot down the discussion questions, but each of the facilitators will have them in the breakout rooms. We're going to open up 5 breakout rooms and ask you all to just spend some time reflecting on year 1, how you all made it through, what were the things that worked, what are you going to keep doing to maintain your momentum with all of this hard work, how do you plan on sharing this with other people? Good work needs to be rewarded, and the only way it can be rewarded is if it's shared. And then what are you thinking about when it comes to year 2? So it's a great chance for you all to connect, bring each other together, and chat it up. So we are going to build out some breakout rooms. In just one moment here. I will see if anyone else has comments in the chat. Yeah, the link and the password for the Padlet should be in there for you all. And it doesn't look like there's anything else. Well, are you able to, or I can?
Well, is it best for me to stop sharing the screen right now? And then
I can just build them. I got it. So I'm going to sign automatically. So what you should see is you'll end up getting an invite that will tell you to join a room. So it'll be 1 through 5. And then just hit OK. You'll be placed in a random room. If anyone, it doesn't look like anyone's joining by phone, but if you are like in both a phone and a video of Zoom, you may not be in the same room. If that happens, come back to the main room and we'll work through that. And so you'll be in your breakout rooms for about 30 minutes to give everyone a chance to share and discuss. You'll assign someone to report out and share. And hopefully our Jam boards will be working really well so that everyone can kind of come together. So I'm gonna make sure. So it should. The 30. Okay. So it should have given you an option to join a room. I think you should be seeing that right now. Looks like the number is going down, so that's a good sign.
Hi, can you hear me?
Yes, Pancella.
Hi, this is Pancella. So I am actually transferring from my phone to the computer in 1 second,
Mhm.
so I can join a room.
That's all
Sorry.
right. I mean, you can still join a room by phone. Hopefully,
Oh, but I just got here, so I'm actually, okay, I'll do that. I'll just do that.
whatever feels good. I didn't know if you were still, moving around.
No,
but-
I was transferring from my car to the house.
Okay.
So I'm
Okay.
actually joining in Zoom right now. And then from there, I'm going to hang up here and then I'm going to come into the room and then you can put me into a room.
Okay. Sounds
Okay,
good.
thank you. Okay.
Um, Okay. Let me actually see here. Who all see how the participants. Grace. And did you get a room? Did you get a group invite, Grace? Do you still need one?
This is Kyra. I was using someone's account for a focus group last week, but I do see an invite. Should I join a group or?
Yeah.
Okay.
So one moment, I'm doing a few things all at the same time.
Okay.
So I'm gonna move someone,
Sorry.
room 3,
Okay.
and then I will be in room 2. Susan. All right, so Pancella, I'm gonna send you to I'm gonna send you room 4 because room 4 is looking a little empty.
Okay.
And
all right.
then
Okay.
Sandra, do you still need a room assignment or are you in the process of joining one? Jasmine, I assigned you to room 3.
I just saw Laura in there facilitating.
Oh, you did? Oh,
Yeah.
okay. So I'll move you to 5 then, because y'all must have got mixed up. And then, hi, Kara. Would you
Hi.
like to join a room?
Sure.
I think you might be assigned one.
I
Yeah.
do see an invite. I just wasn't sure if it was still popping up as Grace or not since my name changed, but I do see room 3 as an invite.
Yeah.
Okay.
If you want to join a room, that would be cool. If you want to hang out here with Bree, you can. That's totally up to you. I'm gonna hop into a room and facilitate.
Okay.
And Bree, will you feel comfortable kind of like assigning people as needed?
Yes, and I also started the timer. Did you start a timer for the
These
room?
rooms should have a timer as well.
Okay, I just
And
wanted
then just, send a reminder when there's about 10, like halfway, maybe like 10 minutes and a 5-minute. That would be perfect.
okay.
All right.
Did this timer on everyone's room start already?
I started the moment I opened them.
Okay. Alrighty. Chandra, have you been added to a room yet?
can you hear me by any
Yes.
chance?
Are you?
Okay.
Yes.
I apologize. I'm having audio issues, so I'm getting ready to come out and go in on my computer. I'm on my phone right now. I
Okay.
was in the breakout room 5. Are you able to put me back in 5 when I come back in?
Yes. Yes.
Perfect. All right. I'll be on in like 1 second. I'm logging in to the meeting right now.
Okay.
All right. Thank you. All right.
You're welcome.
Yep. Hear me. Sorry about that. Hey.
Okay, so you should have received an invitation for room 5. Yeah, 15 minutes. Hi, Chandra. Are you all set for breakout room 1? Hi, Andrea. Do you need to be put in a breakout room?
Hi, yes, please.
Okay, were you already in a breakout room?
No, I wasn't. I just got on.
Okay, one moment.
Okay, thank you.
You're welcome. Hi, Janine. Do you need to be put in a placed in a breakout room?
No, sorry, I'm trying to leave. I've got another meeting I have to pop into.
Okay, well, have a
Thank-
wonderful day and thank you so much for joining us.
Thank you, you too.
Hi, Leslie. Did you need to be put in a breakout room?
No, that's okay. I really just come for like the update stuff at the end. So I don't have a lot, my programmatic team is already in the call and in breakout rooms. So I'm more of an admin role. I don't have a lot of value to bring.
Oh, that's fine. You can just go ahead and chill here with me. We only have a few minutes left.
Thank you so much.
You're welcome. Welcome back, everyone. Just a few more moments or a couple seconds, and then everyone will be headed on back to the main room.
Welcome back, everyone. I just want to say, thank you for participating. I hope that your group conversations went really well. For the facilitators, so Afton, Lindsay, Laura, Jasmine, did you all feel like you were able to get through a good chunk of the questions? Do you feel like your groups need more time? I think if we got through, my group got through 3. So I feel like if your group had a good conversation, we don't need to go back in, but I just want to check in.
We got through all of them, but the last 2 we didn't get great discussions on.
That's all right. Yeah, it looks like group 1 got through all of them, got through 3. Yeah, all right. So, next slide for you. So I'm just gonna ask for a group to volunteer to go first. So whoever agreed to be your reporter, either raise your hand or come off mute and share a bit about the conversation that you all had. All right, Khadijah.
All right, while it's all still fresh.
Yeah.
Do you want me to go through, we got through 3 questions. Do you want me to touch on all 3 that we discussed?
Give me the greatest hits.
All right, let's do that. Okay, so the first one was just some highlights from the lessons that the different CBOs learned. And so a few of the things that were lifted up and elevated was how important it is to make sure that the community members themselves have the ability to take the lead in different situations, and that allowing that space through really proper facilitation is really key. That planning ahead for red tape came up a couple times in our group, where things can move slower sometimes than you think in terms of navigating red tape around the different structures and grants to the community. So just allowing extra time for that. Also, just allowing really being able to provide the mini grants and funding was key in terms of being inclusive and being able to lift up and recognize what the community members are telling us they need around these strategies. And so that, I know that's part of the structure, but that how important that really was, that process of allowing funding to be distributed. So our next question, the highlights from some of the challenges that we overcame and barriers that were faced, was establishing a list of guiding principles and rules. And we definitely, in our discussion, multiple groups kind of shared that, everybody doesn't always agree when you're in meetings or council meetings together. So establishing those guiding principles to make sure that the power structure is balanced, that things are equally facilitated, that people's voice can be heard, but decisions can still be made in an equitable way. I would say that we had a pretty robust discussion around the importance of that and just different experiences with that. And being also able to have additional meetings in between regular meetings came up as a way to address some barriers, because it allowed you to filter through different challenges that might come up and stay on course. And then our last kind of high level piece on the question around building practices to maintain momentum with our council. We discussed the importance of being able to draw on the strengths and the passions of your council members and have them really be able to flow and operate in the space of what they're passionate or that they have a strength in. So one of our members was just sharing that there was a council member who had a strength in writing and experience in doing those types of things. And so being able to engage them, and that was important. You know, I shared that we had a council member who has a data background. So we kind of pulled on that person to help do the data sharing from our surveys. And that's really been a way of engaging. And we talked also, this was really interesting, but several of the groups have used their council members for the CHA or CHIP data. And I know that that's different depending on what group. We've actually done the same thing too, where we've partnered with our local health council around that. So being able to include the voice of the council members in those health assessments and make sure that they're part of the process definitely seemed like a strategy that several groups were using and a really important one. So that's the high level updates from our group.
Awesome. Thank you so much. Any other?
I'll go.
Oh, I got nothing.
This is Jason. I'll go.
All right. Thanks, Jason.
All right. Yeah, no doubt. The only reason is because I'm having tech stuff going on. So I'm just trying to make sure
I'll take it.
All right. So what are some of the lessons learned from year one? Keep it simple, scale back on a number of mini grants. Onboarding partners into the system takes time. Be mindful of reporting requirements for grantees. Understand what I do and do not have control of, and do the best with what is within my control. Larger awards for the mini grant awardees for a larger impact. Use automation when possible and avoid work. Use automation when possible and available. Work smarter, not harder. And the example was a Google form for monthly reporting. Trust and depend on colleagues and their abilities and strengths, and leverage expertise and resources from the council. And I'm not going to read every single one like I just did. I'll just do just a couple big ones. Change monthly council. Oh, this is how did you overcome the challenges? Change monthly council meetings to allow for councils to review our monthly reports before submission. Flexibility was a big one. Work with MPHI and councils to develop a survey monkey for reporting of mini grantees, and added contract language to the extended funds if available to save time. How are you working to build practice to maintain momentum? Ongoing monthly meetings, writing partners into grants, bringing resources to partners through other partnerships, chair and co-chair structures, utilizing, once again, Google Form questionnaires to gather input from the council's shared decision-making, and co-facilitation with council members. How do you plan to share your story and journey of the work that's been done so far? Newsletter. On May 9th, we have a awardee share out event, website updates and presentations in the community and or conferences. And the fifth question, what, if anything, do you plan to do differently heading into year two? Increase grant size, more HEC members brought to the councils, slow down where we can, schedule dates in advance, increase automation, translate our grant application into multiple language. And then Ingham County is in the process of creating a logo for our Health Equity Council to give us some validity. And that is all I have. Thank you, everyone.
All right. Thank you, Jason. I see two different reacts. There's like a celebration, like a party hat. Does that person want to go next?
If not, I can take our group, the first question.
All right, thank you so much, Sandra, and then I'll pass it over to Heather.
Okay, so for the first question, what are some of the lessons learned from the first year? One was relying on already established processes and experience of the community. Being prepared for the pivots that come. Offering different formats for the mini grant process, working through the shared rubric of the grants. Do more with quality and connecting time. The mini grant process as a whole was a learning process. Need for and the value of data for our community partners as a tool for valuing the needs and gaps in the community. And grant education series had a whole collection of grant writing workshops dedicated to date. And that's all I have for the first question.
All right, thank you, Sandra. Heather?
Yep, I'll do the second and third. Let me grab to
Great.
the our Jamboard.
Thank you.
All right, so here we go. You don't have two screens. All right. For how did we overcome some of the challenges that we faced? Some of the challenges that were faced that our group talked about was simultaneous translation with Zoom can be difficult. So having either it translate it for you or having a translator. I know in our group, we have someone who is hard of hearing. And so she, even if it's in person, we do have a Zoom link so that she needs to be able to read our lips. So we have to sit in a specific way, but she puts the closed captioning on so that she doesn't miss anything. So I can definitely relate to that. Translation of just items, right, and data into different languages, thinking about the time constraints to that. In-person facilitation was a challenge for some individuals in our group, particularly for the larger capacity building or trainings. And then also having challenges with our Board of Commissioner conflicts. So that oversee the budgeting of the grant that we were approved was a challenge for another individual. In terms of how will we be working to build practice to maintain the momentum with our council, a couple individuals talked about that they're going to do a ending of the year celebration and meeting, kind of celebrating the mini grant recipients, having them come and share the work that they did with the money that was provided. For year 2, they're going to focus on community health worker training to ensure access to services for those living with long COVID in their particular region. Again, more celebration of successes, reporting out with maps, stories of those specific sets successes, and then doing some succession planning or stability planning as well. And then adding additional members to the group. So with one group, they saw a need for Middle Eastern individuals, and so reaching out to that demographic to have them join their council as well. And then we did not get to the last 2 questions.
Thank you, Heather. Thank you, Sandra. We have 2 more groups left. All right, Sam. Thank you.
Hi. We did get through all the questions, so I'm going to try to run through the highlights. Some of the lessons learned were there was a lot of conversation about the scope and lift of the coordinator role. That was important work, but was very, labor intensive, and the scope of that was deep. Council partnership, really learning how to foster the partnerships within the council to really help the council gel, how to engage additional organizations outside of the council, and then getting the council out into the community and really discussing why it exists, that there was a lot of value to that. And doing that a little sooner would have been great. But of course, the additional lessons learned, you've got a chicken and egg thing. Additionally, some discussion about navigating stipends and variances in engagement, how to best do that. And a lot of sentiment that, you know, as we close out year one, everybody really feels like really starting to hit the stride, right? Like year one was a lot of foundational work, and now we're really seeing that move forward. Some challenges and barriers. And at this point, I actually stopped delineating which question was which, so I apologize, but they'll apply. Really setting space where voices are heard, establishing that it's a safe space. And we had some discussion about some of the conversations. I think in all the councils have had some conversations about, you know, tough, important, but tough conversations. So both setting that space where voices are heard, particularly those who unfortunately are, you know, maybe accustomed to their voices not being heard, but then also those tough conversations with sometimes partners and entities outside of the council and how to make the space for that. One of the groups talked about some trainings that they did with one-on-ones to help council members build those relationships between individual council members. In regards to telling the story, some discussion about how to leverage the reporting to tell some of the story, identifying some of the efforts that, you know, have happened sort of organically in discussions that really do relate, that could be lifted up. And I know that there was some talk of some of the regions with equity summits and council members sharing out in a real community facing way.
So thank you, Sam. I think there is one group left. I believe it's group one.
Yes, I will try to give a quick overview. A lot of the things that have been shared so far are pretty consistent with our group, but some of the lessons learned. So one of them was when you intentionally build a diverse council, you will get a great diversity of thoughts and ideas. And so that's something that, you know, kind of comes out of it. Also, learning to prioritize council opinions and priorities, planning for meetings, providing structure for decision-making and feedback, and then also identifying opportunities. We've had some interpretation items as well. So being able to utilize Zoom to accommodate that. Lots of discussion in that space, but we've hit on most of those items. In terms of how we overcome challenges and barriers, patience was one of them, and also spend a lot of time identifying representative council members and what their needs were, and really allowed the council to develop organically. So making sure time was taken to, you know, just let things unravel as they're supposed to. In terms of building practices to maintain the momentum, one thing that we had consistently in our group is there was a lot of cutting back meetings to be respectful of time. So now that these councils are developed and there's a working relationship and they've identified ways to communicate with each other, they're able to decrease the meetings. Some were meeting multiple times throughout the month. So being able to pare that down is definitely a way to continue to make them successful. Visioning with the community to make sure things are moving along. And then also one of our folks acknowledged that political context is helping to kind of move all of their efforts along as well. How to share your story, webpage and press release once the strategic plan is done. Someone acknowledged that it's difficult with the local political context. And then also we've had a couple individuals that acknowledged they wanted to plan a summit, have a website, some sort of word of mouth distribution. And then finally, what, if anything, do you plan to do differently into year two? Considering equity of council processes and adapting them as needed, opening up mini grants more broadly throughout the county beyond just council members. And then some mini grant projects inspired focus and future priorities. So examples of that would be transportation and language access. So those are our high level summaries.
Awesome. Thank you, Nicole. I think we saw a lot of themes across the board. The idea that this work does take time and that we learned a lot about what works, what doesn't work, how we can pivot, allow space, and also take that time to celebrate at the end. It sounds like a lot of folks are creating some space for that and also establishing some time for it. So next slide is a break. So take 5 minutes to just take a quick stretch break, do any personal items that you need, refresh the coffee, and then we will connect back at 2:31. Thanks, everyone. All right. So we are winding down our agenda. One of the things that we really wanted to share with you all and kind of provide a brief update on was a bit about how we all collect race and ethnicity data and how we establish those standards at the state level. So I'm going to pass it over to our epidemiologist coordinator, Jasmine Hall. Some of you have met her through your TA request for data. So Jasmine, if you want, feel free to take off.
Thank you, Danielle. Hi, everyone. As she said, I am Jasmine Hall, the epidemiologist coordinator here in the Office of Equity and Minority Health. As some of you know, part of my role is to help support you in the data requests that you put into the department. And the other part of my role is to help support the epidemiology work that we do throughout the department. Here in DHHS, we're looking to lead with race, and to do that, we have to have a standard way to collect race and ethnicity. Bless you. Could we go to the next slide, please? So why are we having this conversation to standardize the collection of race and ethnicity? We want to be able to identify health disparities in Michigan. We know with the COVID-19 pandemic, and even some of the data we looked at today, we don't always get to see racial disparities. We often have, big unknown categories where we have questions about, how are we collecting race? Because sometimes it's done differently across different departments. And of course, within the groups that report to us, it's sometimes done differently. So we want to be able to accurately identify those disparities. We want to be able to improve the delivery of our MDHHS programs to racial and ethnic populations, whether we're talking about SNAP, whether we're talking about Medicaid, whether we're talking about newborn screening. We need to make sure that our programs and our services are adequately serving our racial and ethnic populations. And the way we know that is by measuring it. And we want to have these conversations to standardize the collection of race and ethnicity throughout the community this summer, because we want to really hear from Michiganders. We want to hear, how do you want to be identified? We're all filling out these forms in every setting we can possibly imagine. And it's important that those of us who are actually utilizing these forms and are, being talked about and discussed are able to have input into how we collect race and ethnicity. Can you skip forward? So I'll talk today through the first 3 pieces of that process and do kind of a mini version of the presentations that we'll do throughout the summer and that we'll do at some of the Health Equity Council meetings, depending on if you'll have us. I'll share kind of how we currently collect race and ethnicity utilizing the 1997 standards from the federal government. Then I'll talk about the 2022 proposed standards that the federal government came out with and has recently closed their comment period on. And then I'll share what we at DHHS are proposing, which would of course be in alignment with what the federal government proposes, but we'll go a little further to really capture how should we capture race and ethnicity within the state of Michigan. In a general presentation, I would go through a series of questions to get input, but I'm actually going to invite you to come to those larger conversations where you can, give input, or you can do it online. So we'll make sure you have that information as well. Next slide, please. So let me actually make this bigger. So figure 1 is the Office of Management and Budget's 1997 Race and Ethnicity Standards and Definitions. So previously, and honestly up till today still, we collect race and ethnicity using a 2-question format, first asking whether someone is Hispanic or Latino or not, and second asking about 5 different racial groups. You can see the definitions listed here of those racial and ethnic groups. You might notice a few things that kind of stand out. These were 1997 definitions. So some of the things have been updated in the 2022 proposal. For example, within Hispanic and Latino, Cuban is listed twice, so that'll be taken out. Within Black or African American, you might notice the word Negro is used, that'll be taken out. Within white, you might notice that white includes people who are from the Middle East or North Africa. That'll be taken out because Middle East and North Africa will have their own racial designation and no longer be classified as white in our proposed standard. And we also, in 1997, also the standard allowed for the selection of multiple races. Next slide, please. So as I shared, you'll see the 2-question format, which first asks about Hispanic or Latino ethnicity, and then asks about race. Moving to the next slide, you'll see figure 2, which is the updated proposed race and ethnicity standards from the federal government. So here you'll see that race and ethnicity is in the proposed standard will be collected using a 1-question format. So rather than asking first about ethnicity, oh, right, never knew about the 1997 definitions, absolutely. So with this 2022 proposal, they're proposing to collect race and ethnicity using 1 question versus 2 questions, and to allow for the detailed collection of race and ethnicity, as you see on the right, where within each of the 7 racial groups, you'll see an additional 6 options here. And these 6 options do not include every single group that could be listed within a certain race. So for example, under Asian, you'll see Chinese, Filipino, Asian, Indian, Vietnamese, Korean, and Japanese. But we know there are other countries and cultures represented in Asia. And so this expanded list is representative of the top 6 countries of origin for people within each racial group in the United States. Moving forward to the next slide, you'll see what we at DHHS are proposing for our short list. So we want to stay consistent. We do agree with the federal government about using a one combined question versus 2, but that's something we also want to get input on. But in our proposed standard, we are proposing a short version where there is 1 question about race or ethnicity. So Hispanic or Latino would be included, as well as Middle Eastern, North African. And then we also have 3 standard non-response options listed for just to get a sense of what is going on with the missing data, just to have kind of some standardization here. Moving to the next slide of figure 4, you may notice that for some of the categories, we have maybe a few more than the 6 listed in what the federal government was proposing. So that difference would be because in the state of Michigan, our top 6 countries of origin is not exactly the same as what you see across the United States. So we wanted to make sure that the largest populations within the state of Michigan are also represented in those detailed categories for race and ethnicity. We also want to continue this these 3 standard non-response options at the bottom. And we also want to have the option to type in or write in any specific race or ethnicity if you don't see yours listed. Next slide, please. So just to kind of recap the key changes that we're proposing and looking to get input on throughout the summer. Changes between from the 1997 standard. So the first one will be to collect race and ethnicity information using 1 combined question. Again, currently, if you have to report anything to the federal government, you're required to use the 2-question format. first, ethnicity, second race. And because of information that we've learned about people feeling really confused about the difference between race and ethnicity, concerns about data being lost, that was kind of that reasoning for that proposed change. The next proposed key change would be to add Middle Eastern or North Africa as a new minimum category. So as you saw within the short list and the more expanded list, MENA would be considered a new racial group. One thing we want to get feedback on is, what should we call this group? Is MENA acceptable? Is there another term that's acceptable? Things like that. So that'll be part of the discussion this summer. And that came about from lots of feedback from our MENA community and our partners saying, we don't see ourselves as white, we aren't seen as white. And thank you, Samantha. And we really need to have a distinct racial and ethnic group. So we are listening to that feedback. The third change will be to require the collection of detailed race and ethnicity categories by default. So again, you saw the short list and you saw the detailed list. We know within certain racial and ethnic populations, there are larger groups and there are differences within those groups. Did Bree drop off? I'll just keep going. And there are differences between those groups. So for example, the Asian population, you see racial and ethnic disparities within that population, and you need to be able to kind of tease those out. So collecting more detailed race and ethnicity information as a standard would allow us to do those, see those within group differences and really be able to illuminate whether or not we are seeing true disparities. The next proposed change would be updated terminology from the federal standards. So in the beginning, I kind of shared a few pieces of that where, in the past, the definition of Hispanic or Latino included the word Cuban twice. The definition of white included MENA. The definition of Black or African American included the word Negro. So just some minor changes to those definitions to be more aligned with the times, because it has been over 20 years since they were updated. We have, as I shared, added a few standard non-response options just to get at why are we having so much missing data? Is it people preferring not to answer, or is it that, it's not being collected? Welcome back, Bree, and thank you so much. And the final key change is that we, talked about is the expanded race category. So we want to be able to include the most common ancestries by race within the state of Michigan, in addition to what the federal government is proposing as a kind of US-wide conversation. So I will just kind of close by inviting you to stay tuned. We are going to take this show on the road and, come to different council meetings. We probably won't make it to every single council meeting, but please put in the chat if this is a conversation that you are really excited to maybe have us come bring to your council. And then we'll also have several community conversations throughout the summer, starting in June, where we'll be going around. We'll have some virtual sessions as well, so that people can give us input. And if people aren't able to attend those virtual sessions, we'll also have information on the website that people can use to give us that feedback. So we hope that you'll get involved. We hope that you'll share it with your councils and help us to have this race and ethnicity standard and improve our data collection. I see some invitations in the chat. Thank you all so much.
So
and
really
I'll turn it
quickly,
back over. Yes.
Yeah, really quickly before you run away, Jasmine, I want to make sure everybody understands your ask here, right? So Jasmine's ask is that we would like to come to councils to share a little bit more detailed presentation other than what she just shared with you, and specifically get feedback, right? So what we don't want to do is decide how groups should be termed and how groups should identify. We want groups to tell us how they want to be identified. So the ask would be that, you know, we're able to come and sort of share some information, again, a little bit more detailed than the snapshot that Jasmine gave you today, but then also get your council members, your community members to give some feedback about why these make sense, these definitions that we're proposing, or why they don't make sense. And if they don't make sense, why is it that it doesn't make sense, or why is it not okay? So again, thinking about, for example, the MENA community, is MENA the right term? Should it be a different term? And so kind of helping us work through getting some conversation and some feedback about those proposed standards. So there's also going to be a form that folks can fill out that will give some answers and some feedback as well. So I just want to be clear, we're going to want some activity to happen at these sessions. It won't just be Jasmine presenting in the sessions with your council members.
Thank you so much, Afton, for re-emphasizing that. And I do see in the chat, Lori asked, will this align with the US Census proposed changes? Yes, yes. And we are very closely watching their proposed changes. They will come out with their final version next summer. So we'll also make sure ours aligns with theirs. And that's kind of why we're getting our kind of input while they're sorting it out, so that our input, so that we can kind of bake in the input that we get from Michiganders, so that our standard meets the federal government, but also meets what Michiganders want. I hope that makes sense. Awesome. Thank you so much. Back to you, Danielle.
I do have a quick question about that, because I know whatever the census decides is going to be the federal standards in terms of data collection. And I am just wondering, as you say, you know, the input from Michiganders, is it just a matter of what's going to be displayed as options?
Oh, well, what the federal government is putting out is the minimum standard. So we have to meet that minimum standard, but we can go beyond that. And for example, we're currently following the minimum standard of the federal government, but a lot of times you'll see when people collect Asian, for example, they'll add a few more options and then they'll just roll it up when it comes to reporting to the federal government. But a lot of states have already gone well beyond where we are and where the federal government has gone. So we will make sure it's in alignment, because they'll put out that minimum.
Okay, well, I know they put out the minimum, and then they also have the guidelines on the maximum in terms of what subcategories fall underneath the race. Because I know states like Oregon, I guess their equivalent of MDHHS is already collecting. I think they have like 3 pages worth of options in terms of race and ethnicity.
Yep.
And so I'm assuming that you'll take a look at what they've got for those subcategories and utilize a lot of that.
Yeah, if it's applicable, yes, absolutely. But thank you.
Thank you.
No problem.
Thanks so much, Jasmine. I really appreciate you sharing all your hard work with all of the councils, and I love seeing all of the engagement, and it seems like we may have some invites coming up soon.
Yes.
So the last thing I want to do is just a few updates, and then give you all some time to ask some questions. So right now, I know many of you have either had or will have your meetings to just follow up and talk more about your continuation application. So, you know, have some questions, talk through budget, what have you. Once we have all of that, we will, you know, send out those award letters. Don't have an exact date to anticipate those, but like I've said, they will be on their way. We'll make sure to get that out to folks in terms of, you know, having something that you can share with any board or entity that oversees processes for amending and entering contracts, just to help streamline that process. Other piece that I want to spotlight is our May office hours. So we have office hours coming up on May 17th at 2 o'clock. And we've been trying to spotlight some of the TA resources that we've been providing. And so we're hoping to have that be an opportunity to talk a bit more about data requests. So you all have met Jasmine now, and you know that she's wonderful. I really like Jasmine. And so we're hoping to have that opportunity to share a bit about the data request process, get more folks interested. It sounds like a lot of people, just from what I've seen in the chat, are really interested in thinking about how to collect data, but also how to present that and connect that to councils. So I want to share that opportunity with you all, hopefully engage folks in a really lively discussion. And as always, bring any questions that you have. It doesn't have to be data related to the office hour, so that we can talk, strategize, and kind of come together. The other piece that we wanted to share is just to get those dates on calendars is the collaborative meetings that we'll have coming forward. So these are just the dates, August, November, February, and May. So following roughly a pretty similar calendar. And all of the meetings, as we have had, will be from 1 to 3 p.m. Oops. And so I just want to leave space. If people have questions, feel free to raise your hand, drop questions in the chat, and we'll kind of talk a little bit.
Can I ruin your last slide, Danielle?
No. Actually, no. Yeah, go ahead.
So we are actively looking to actually hold that August 1st meeting in person. So we heard the request from a couple of you all that you'd like to meet in person, have some activities together, spend some quality time getting to know one another in a less formal format, right? So we aim to please. So more to come. We literally just started planning, turning that one into an in-person meeting yesterday. So we have literally nothing outlined at the moment, but we did hear you. We are going to make it happen. And so we'll get you some details as soon as we actually start getting some things ironed out. But because that one will be in person, the time will probably be longer than the 1 to 3, because we want to make sure you all have plenty of time to spend time together. And we will, actually have something that we do as a unit at that meeting as well. So we're trying to nail down the time for you as quick as possible, and the location for you as quick as possible, so that you all can plan ahead.
Yes, definitely. We will. I love food, Priscilla. So yes, fellowship.
It will definitely be a snack. I can guarantee you that much.
Yeah, that will be like around when I'm gardening. I know some people have heard me talk about gardening in the office hours, so there may be some tomatoes to be had. Maybe some raw ingredients, not quite a full piece, but we'll see.
Well, Bree and I like to bake, so we can promise you a baked good or two. So, but at least you can have a baked good and some bad coffee, because otherwise, did we really meet in person?
Oh my goodness. Actually, I'm gonna go with Dottie. She's gonna be on an island. So that sounds nice. But as Afton said, we're still finalizing the location. I'm hoping to be able to share that with folks really soon, but I at the very least wanted to share the date and the general meet of the day time for the meeting. And once we have our venue established, we'll share that with folks. We'll also be sharing some calendar holds as we did last year, so that you all have these dates on your calendar. But I also know that you like to leave meetings knowing what's coming next. So ta-da. Here you go.
I do have a quick question. So are
Mhm.
these dates for year one grant recipients, or is this contingent if you get funding for grant in year two?
So it would be for year 2, yeah.
Okay,
But I didn't, I don't want to delay. Summer is a bit of a wonky time when it comes to calendars and vacations and life events. So I definitely wanted you all to have that August 1st date as soon as possible. Any other questions that people have? All right, so I just want to say thank you to everyone for attending. We will be sending out the recording and the slides as always after. I'll also be sure to share the Jamboards that you created in your group so that you can just kind of get a walkthrough of what each of the groups talked about, be able to learn more. And I hope that you all were able to create some new connections in those small group activities. Thanks, everyone.